Yeah, good afternoon. Just give me 1 minute. I'll I'm just downloading my presentations from my email. So since it is a we are taking HIV and AIDS. HIV and AIDS also coexist with co-infections like TB and tuberculosis and other comorbidities. They are altogether known as opportunistic infections. So I'll HIV TB is a very vast subject. It's the topic is covered in medicine, pediatrics, obs and gynae, and various other departments. So in community, it's a very vast subject. I'll try to cover everything, but maybe we have less classes with you for this particular purpose. I'll cover the most important parts of the topic and. I think there's a problem with downloading here. So I'll take HIV and tuberculosis co-infections today. We'll talk about that. So internet is slow here, I guess. Let's see. So other documents are getting downloaded. In the meanwhile, I'll try to cover some of the other portions of HIV in this lecture. Okay, we know the definitions of HIV. We know the definitions of history. We know the structure and lifestyle of the life cycle. Coming to structure and life cycle, I don't remember if I covered in some other slide, but I'll cover it again. HIV's retrovirus contains of two strands of positive ssRNA. It contains reverse transcriptase and integrase. Integrase helps in the insertion of HIV DNA into host DNA, infects helper T cells and macrophages. The outer membrane contains of protein GP120 and GP41. Both are important to both are important to absorption and presentation. Sorry, penetration. GP120 binds to the uh, transmembrane protein CD4 on the host cell and then is removed by conformational changes. GP41 then pulls the virus and host cells together, allowing the membrane to fuse. The capsid breaks down and the viral RNA and enzymes are released into the cell. Reverse transcriptase converts the viral RNA and DNA. This DNA is known as proviral DNA. Integrase inserts the proviral DNA into a host DNA. Once the proviral DNA is part of the host's DNA, it is known as the previous and can remain dormant in DNA. When the provirus is transcribed, three main genes are transcribed: ENV, GAG, and POL. The non-functional polyprotein are made of these genes. Uh, One of the looks like it's not being downloaded somehow, some reason. So this is a life cycle. Sorry, I'm skipping the microbiology part. Life cycle, life cycle of the infection. The infecting virus adheres, enters the body, and there is a reverse transcriptase, and then integrase. Okay, this is a cycle of life cycle of virus. Mode of HIV transmission. So mode of HIV transmission, already we discussed this. It's also already we discussed. Okay, coming to testing of HIV/AIDS. Administration is blood, urine, or oral, right? Let's see if those are downloadable. So administration is blood, urine, and oral fluids. Enzyme-linked immunoabsorbent assay or enzyme, that is ELISA, EIA. Radioimmunoprecipitation assay, indirect, that is indirect or indirect fluorescent antibody assay. Polymerase chain reaction, and Western blot confirmatory test. Now, urine testing is as sensitive as testing blood, and safe. It is a safe way to screen for HIV. It can be used. It can cause false positive in certain people at high risk of HIV. Oral testing is the only FDA approved HIV antibody. uh, it is as accurate as blood testing and draws blood derived fluid from the gum tissue and not it's not a saliva test. Coming to the treatment classification of antiretroviral medicines, that is nucleoside transcriptase inhibitors, nucleotide reverse transcriptase inhibitor, or and non-nucleoside reverse transcriptase inhibitors, and protease inhibitors. Other ARVs uh, entry inhibitors are fusion inhibitors, uh, penetration blockers, and etc. So these are the agents which are approved and their doses and frequencies. Zudo, zudovudine, nucleotide reverse transcriptase inhibitors like zudovudine, diadenosine, stavudine, stavudine, lamivudine, abiracavir, combivir. So these are the list of this thing with the milligrams and the dose on the right hand side and the frequency. NRT mechanism of action. NRTs must undergo the the NRT must undergo intracellular phosphorylated. NRTs must undergo having a problem with talking with double mask. Okay. NRTs must undergo intracellular phosphorylation to be active. NRTs inhibit the viral reverse transcriptase enzyme, the enzyme responsible for transcribing viral RNA into double-stranded RNA. Right. They prevent the addition of natural nucleosides into the DNA strands. This halts the production of new viruses. NRT's adverse effects are like zudovudine, there is a bone marrow suppression and anemia or neutropenia, nausea and nail discoloration. Abcavir is hypersensitivity reaction, fever, rash, fatigue, malaise, nausea, vomiting, diarrhea, loose appetite, and pharyngitis. Lamivudine, generally well tolerated. Empiricabine, hyperpigmentation of palms and soles can happen. Peripheral peripheral zudovudine, peripheral neuropathy and pancreatitis increases the triglycerides. Dinosine, pancreatitis and peripheral neuropathy and diarrhea. And tenofovir, that is GI upset, flatulence and nephrotoxicity. Non-NNRTIs These are the dose, these are the agents. NNRTI's adverse effects are rash 7%, increased transaminase levels, hepatitis, hepatotoxicity, more common in women with permanent CD4 cell count which is more than 250 cells per millimeter cube. Men with CD4 plus cell count more than 400 cells per millimeter cube, and patients with co-infection with hepatitis B and C. Monitor LFTs minimally at baseline, 2 weeks monthly for the first 3 months of all patients. Efavirenz rashes around 1.7%, increased transaminase levels, CNS, and side effects. For example, vivid dream, dizziness, and drowsiness, which can happen because of that. So again, the list of protease inhibitors with their doses are listed here. Protease inhibitors mechanism of action is protease enzyme is responsible for the uh, cleaving large polyproteins into structural proteins and reverse transcriptase enzyme. Protease is needed to form a fully mature functional virus that is that is enabled to replicate and produce more viruses. Protease inhibitor prevents this enzyme from doing its job and later steps of the viral life cycle. So this is the effects of each protease inhibitors. I'm not going into the details of this, but you guys can go. Fusion inhibitors. Okay, fusion inhibitors. Okay, mechanism of action of fusion inhibitors inhibits entry of HIV into CD4 cell with inf- infovirus viritide binds to glycoprotein GP41, the protein on the viral membrane. This binding prevents the change in the shape of membrane protein and prevent fusion of the viruses and CD4 cells. The penetration blockers are Maraviroc. The mechanism of action is Maraviroc is a CCR5 inhibitor that binds to the host cell through CCR5 receptor. It is also active in patients who have various who have virions that use chest CXCR5 for cell entry. I think preventive measures we already know, but I'll repeat it since we have time now. Methods of preventive measures are refraining from unprotected intercourse, refraining from intravenous drug use. People who have HIV infection should not donate plasma, blood, or organs for transplantation. tissue or cells. All pregnant women must be counseled about HIV early in pregnancy and encouraged to undertake an HIV testing as routine part of the standard antenatal care. Those found to be HIV positive take a course of ARV treatment and reduce the risk of their infant being infected. Methods and control care must be taken in handling and using the disposing of needles or other sharp instruments. WHO recommends immunization of asymptomatic infected cases. Children. WHO recommends immunization of asymptomatic HIV infected children with the EPI vaccine. Those who are symptomatic should not receive BCG vaccine. Live measles, mumps, rubella, and poliovirus vaccines are recommended for all HIV infected children. HIV testing and counseling is an important intervention for raising awareness of HIV status, promoting behavior change, and diagnosing HIV infection. HIV and AIDS is a world epidemic. Although making new advances is in combating the viruses, there are many new infections every year. All sound, all should know what how it spreads and how to prevent it. Should take HIV/AIDS test if involved in any risky behaviors, and also should tell others the importance of getting tested in and prevention. There is no cure for this virus, so there is no room for ignorance and on this matter. Okay. Sorry, my slides could not get downloaded today. I will try it again. If that is downloadable, I can start it and we can continue tomorrow. So my wanted to talk about HIV and tuberculosis, but unfortunately I didn't get downloaded. Anyway, we will continue HIV and tuberculosis tomorrow. I'm sorry that there was a I could not start my this thing. Internet is slow. Slides could not be downloaded from my email. Have a good day and